Nearly changes in the skin. Skin becomes ashy white, pale and loses elasticity within a few minutes of death. Lips are dry, brownish and hard due to drying. Changes in the eye. Loss of corneal reflex is one of the 5 Minnesota criteria of brainstem death. Opacity of the cornea. Cornea becomes opaque after about 6 hours after death. This is the time period up to which a cornea can be harvested for a corneal transplantation, up to 6 hours. Classically, grey-black cloudy cornea were considered as a sign of death, largest sign. It is now known that it become opaque during life too. Diffuse corneal opacity in glaucoma, localized corneal opacity in keratitis, corneal ulcer. If the eyelid remains open after death, desiccation of sclera give rise to a somewhat triangular shaped discolored area. Tachynoidea sclerotica, black spot on the sclera simply. Tachynoid, black spot. They are yellowish in color in the beginning, but as dust settles in, they become dark red or given black. Sometimes they may be bright red, giving rise to an artificial appearance of congenital hemorrhage. Tachynoid, the dark red triangular area on the sclera base sits on the outer rim of the cornea and apex touches the outer canthus. Triangular area on the middle side is less pronounced. The next is flaccidity of the eyeball. Eye looks sunken and softer after death due to fall of intraocular pressure. Normal IOP during life is between 10 to 20 mm Hg. 1 hour after death it is 12 mm Hg. After 2 hours 10 mm Hg. After 3 hours 8.5 mm Hg. After 8 hours 5 mm Hg. Measurement of intraocular pressure. Thus give a rough estimation of the postmortem interval. Pupil. Normal pupil size during life is 1 to 8 mm. No appreciable change in pupil size after death. It has however ascertained that soon after the death the pupil may dilate because of the relaxation of muscles. Later they are said to be constricted due to onset of rigor mortis of constricted muscles. Even if this happens, the difference are not measurable. The pupils react to atropine and pilocarpine for about 2 hours after death in molecular death occurs. Pressure is applied by fingers on 2 or more sides of the eyeball. The pupil may become oval, triangular and polygonal. Retinal vessels. Segmentation of the retinal blood occurs immediately after death. On ophthalmoscopic examination, the continuous blood column in the retinal blood vessel breaks up into small fragments, which then collide with each other. This has been likened to the movement of unbraked wagons of good train when it stops. Hence, the term railroading or trucking or cattle trucking for this phenomena, although the phenomenon is since a Kevorkian sign. This also sometimes repeated Kevorkian sign. The mechanism of obscure it can be due to rapid loss of blood pressure after death due to shrinkage of the fiber in the clotted blood within the retinal vessel. Color of retina. Retina becomes pale after death and becomes more and more pale as time of death increases. Disc outline become hazy after a few hours. This one is that. Okay. Then biochemical changes during the railroading seen on ophthalmoscopic exam just after death. Biochemical changes during life. Potassium concentration is low in the vitreous humor but much higher in peripheral tissues such as retina. Low in vitreous but higher in peripheral tissue. After death, the potassium from peripheral tissue starts diffusing into the vitreous, raising its concentration. So potassium increases. Thank you.